Hello and welcome. I'm Eric Skindred with the Hospital Association of Southern California. Today we're speaking with Dr. Stanley K. Frencher, Jr. Dr. Frencher is Director of Surgical Outcomes and Quality at Martin Luther King Jr. Community Hospital in Los Angeles. First of all, thank you, Dr. Frencher.
Yeah, absolutely my pleasure to be here.
So in this audio interview, I thought I'd ask you first about general hospital operations during the COVID-19 pandemic. How is the volume of work and just the extraordinary nature of what we're experiencing affecting hospital workers? And how are people who work in hospitals coping?
Yeah, I think that the experience has been unlike anything any of us have ever experienced. I think for the first time as frontline clinicians, many of us have fear of our own safety and own health in practicing medicine. And I think that really has changed the dynamic that many of us have with our patients. With that said, I think that the work that our nurses and physicians and surgeons and ancillary staff have done is heroic. In terms of the absolute volume that we've seen, certainly being here in South Los Angeles, amongst a vulnerable population that is known to already have deficiencies in the availability of services and healthcare, we've of course seen the pandemic hit us more probably than any other group. So you have patients who come in who have been exposed or are unclear to what their level of exposure is, who suffer in silence given the living conditions that they live under, often living in smaller apartment-like environments in close proximity to one another. So, of course, we have a combination of people who are coming seeking kind of information and the need to know if they have COVID, but also managing patients who've been diagnosed with the disease. And in doing so, I believe that the hospital's done an amazing job.
Wow, thank you for that snapshot. Okay, next, I'd like to ask you something that you have direct experience with professionally. What kind of toll is fear and fear of the virus, fear of visiting hospitals taking on people's health as they delay care in the face of the pandemic?
I think one of the interesting and challenging things we've seen is how the pandemic has acted very much like not having insurance. Folks who experience this pandemic, have decided many times not to seek healthcare at all. Despite having chronic illnesses that have acute exacerbations of them, despite having new diagnoses of cancer or other surgical conditions that they simply put off seeking care for fear that by going to a hospital or even a clinical environment, they may be exposed to COVID-19. And I think we have to work very hard in the way we communicate to our communities, patients, and even other healthcare professionals to try to figure out how to better empower patients to seek the care they need. I think that we've had patients who I know personally who delayed diagnosis to the point where their conditions now are either not treatable in a way that we could have when they had been diagnosed sooner, or have succumbed to their illness as a result of not coming and getting their care when they needed it. So I think that when we look back at this pandemic, the impact it's had on healthcare seeking behavior is something we're going to have to learn a lot from and plan better in the future to both manage the pandemic, but also manage the ongoing healthcare needs of our community in the face of it.
That's certainly an informed view of what people are experiencing. I really want to thank you again, Dr. Frencher. Thank you and good luck to you as you go back to the front lines and serve the community.
Well, thank you very much. I appreciate the opportunity to speak with you and want to just thank all of my colleagues who work in healthcare for their sacrifice and their service.
Sure thing. Take care.